I'm Owen. I'm 14 years old and I'm going into ninth grade. What's going on with my foot is TTS or Tarsal Tunnel syndrome. It causes a lot of pain with like walking and standing sometimes. Just general movement and anything that involves your feet will sometimes hurt after a while.
So I am Stella's mom, and Stella is my youngest child. She's 8. Let's see, gosh, it was a couple years ago, maybe 2 years ago. She started asking for foot rubs all the time.
It does feel like a little bit of a burden to me because I don't feel like I'm able to do things that a lot of other people can. Running, I can't really do that because after a while of like running, it just starts to hurt my ankles a ton, which kind of evidently make it a lot harder to run. Sunday, I was walking over to the gas station that's down the road, just that way. I was coming back and I was just in excruciating pain walking back just due to the fact that I had been walking for 30 minutes straight, just about.
It really hurted, like right here and my calf, because we were doing bounce houses after bounce houses, and we went out, and then my foot started hurting right here, so I had to get an ice pack.
It hurts like in the ankle, on the sides of like the ankle going down-ish. I had been feeling pain like in my knees and feet for my entire life, which also just causes pain in your knee. Like, do you remember like the knee pains that you experience during like growth spurts? It's like that, but I would say it's like really intensified. Different activities that involve your feet. Walking, running, sometimes just jumping after you've been active on your feet for a certain amount of time, that'll cause a little bit of pain.
She had been at dance one day and came home after tumbling, so she does a lot of like flipping and acrobatic stuff. So she'd come home and she was crying that her feet hurt. And so from there, she complained for a good like month or two, but I didn't see anything. There was no bruising. There was nothing that was really there. So at that point, after we had spent hours icing it and trying heat and bathtubs with Epsom salt and all the things that they would do, kids with sports injuries, like just kind of soaking them. Still nothing, and so we finally saw Dr. Jarman.
We had found out about him online. There is an app that is constantly sponsoring one of the authors and podcast creators that we love the most, John Green. There's a podcast called Dear Hank and John. A common sponsor for that podcast is ZocDoc, and we found Dr. Jarman on ZocDoc because he had like really good ratings in podiatry, and we were like, oh wow, we should go see him for our issues. And then he did a couple of like diagnoses tests with like just hitting the foot where all the muscles and tendons are, and that helped him kind of just conclude with diagnosis. He was just like really helpful about knowing what could be going on and putting it into terms that maybe not everybody understands. Like that was one thing that I felt was really helpful. I'm wanting to just not have to deal with general pain anymore. Because I know that that's the very basic answer, but that's really all we're gonna get out of it, is just escape pain, be able to do more things.
What's happening tomorrow?
Tomorrow, the surgery is gonna happen. Like, first thing in the morning, we're gonna get up and we're gonna have to go over to the surgery center and the OR to get the surgery done. So that's what's happening tomorrow.
The pain just isn't going to go away as an orthotic goes. Like there's nothing that's the injury to her heel won't heal all the way without kind of getting that nerve problem fixed.
How do you feel about getting surgery, Stella?
I'm scared, but also like happy, so like I can get back to dancing, and then so they like fix it, so then I can like be my normal self again.
So today we're going to be doing a tarsal tunnel nerve decompression on Owen. We're doing this on Owen because in his workup he has failed all conservative care to resolve his issue. And the diagnosis is tarsal tunnel. Tarsal tunnel conservatively is incredibly hard to treat because there are really not any effective modalities to resolve or treat tarsal tunnel. Tarsal tunnel is a nerve compression, and this nerve compression creates this chronic radiating pain in these children. And so conservative care just fails and fails and fails. But what is very successful is a tarsal tunnel nerve decompression. And so today that's what's going to be happening with Owen. In this area right here around the heel, there are like branches of a tree, and there's probably about 3 to 4 branches that kind of come off, and they kind of create this congestion in this area. And then when they're inside this enclosed tunnel, that pressure is applied right onto the nerve, and that creates this neuralgic feel that just radiates down here to the bottom of his foot. So we've already completed a full tarsal tunnel, and this will definitely alleviate his symptoms, and now we're just going to close it up. Tarsal tunnel surgery is a very delicate, it's a very intricate procedure because there's a lot of decompression that has to be done around the nerve. It requires what we call full tarsal tunnel nerve decompression. If the nerve is not fully decompressed and you miss an area of this compression, unfortunately the patient can go through this entire procedure and still have the same radiating pain. And so it's obviously very important that these procedures be done by someone who is skilled, someone who's experienced, someone who does this routinely.
I am nervous but excited too to get it done so I can get back to dancing.
Oh, cute.
I'm excited for you.
I'm excited but nervous. But the excited part is I'm excited to get back to dancing.
Yeah. Well, I'm excited to fix it for you. Okay, I'm gonna make a little mark. Do you remember which leg we're gonna do today?
Right.
The right leg. Yeah. So you want to keep the cast dry, clean, and intact. So that means don't get it wet. If you shower, bathe, make sure it's in a bag it. We're gonna see you in 2 weeks. We'll take that cast off, and then we'll put you in a boot, and you can start walking. So Stella is a 8-year-old girl, and today we're going to do a tarsal tunnel nerve decompression. As we've kind of discussed, these are kind of difficult to diagnose, work up. Right here on the inside of her foot is the tarsal tunnel, and somewhere in here, and we're going to find out here shortly, there is something compressing that nerve that gives that radiating burning sensation. As the nerve passes through here, it forks and provides skin intervention here on the bottom and the bottom on the inside, medial and lateral of the foot. So when we decompress this, all of this pain that she gets that radiates from starting about right in here all the way down the bottom of her foot, that should go away today. This is the area right in here. This is where the tunnel lays, and somewhere in here, the nerve will get compressed right up through here or right down through here. her discomfort is about right in here, so we're going to find out exactly what is in there that could be causing this. We can already see there's a bifurcation happening here. There's one there, but we can see that this band right here, sometimes it is just this band, a fascial plain band that runs right underneath there, and that might be it. So we'll release this, and then we're going to look to see if there is some other type of like vascular anomaly underneath that.
So what is it that you did that's going to change things for her?
Because I removed that fascial band and opened the tunnel up. So I'm going to bovie the edges because this is to prevent re-adhesion. But that's the cause right there. It's just vascular dilation within the tunnel. And now keeping that tunnel, these adhesion, keeping this open so it can't grow back over it, will prevent it from coming back. When I open these up, if I feel like there's going to be some drainage, I actually will change the way in which I close it to more traditional. Whereas like this one, I feel very comfortable. It won't drain very much, so we'll do this type of closure.
A week before the surgery, there were a few issues of I couldn't necessarily flex my ankle in the same way that would be considered normal, per se. I had issues with just moving my ankle in time without pain. The compression with like the tendons would just cause irritability inside of the ankle, and I couldn't really walk anymore. Then now I don't really have that issue anymore.
Where are we? How are you doing?
Good.
How's your foot doing?
Good.
Yeah. Well, do you want to tell them where we're at?
Rhythmic dance complex.
Yeah, we're at Rhythmic Dance Complex now. Yeah, when she woke up from in the operating room, I think at first she was, like anybody else, you're a little confused at first. And then she kind of went, oh, my teddy bear's here, my blankets are here. Like, it was already casted, so there was already a cast on there. There was nothing she could really see. And the pain was managed pretty well, but about half an hour in, when she kind of started to come off of that, she started to feel the pain a little bit. And there was a couple tears, but honestly, you were so brave. You were so brave. And they were amazing. The surgery center and Dr. Jarman, they came and checked on her and made sure everything looked good. And I mean, that whole process was super fast, super easy.
The conditioning started, I think, exactly 2 days after I had taken the boot off, which is jarring to say the least, but it definitely did help ease everything in. It was like, whoa, I don't feel constant pain when I'm just out and about walking a mile and a half.
And that same day that we came out of the surgery, we drove up to Sholo, which is 3 hours away. We put her in the back of the car, had pillows around her, and just on pretty much ibuprofen, she was fine.
Now it's actually pretty good. It hasn't been hurting.
So before the surgery, it was we had the crying almost every night, the painful, her calves were hurting, her bottom of her feet were hurting. You were asking me to rub your feet every single night, and it was still almost too painful to touch. You were having a hard time dancing. She was tipping in dance. Now after the surgery, I don't think you've cried one night.
It's a short recovery in the sense that you can walk again in weeks, mere weeks. I think it only took 3 weeks for me to be able to walk again. Specifically with Dr. Jarman, if you're working on this under him and his vision, he is a wonderful, wonderful podiatrist.
You said, I just want to get the surgery out of the way so that I can dance again. And here we are, you are dancing. So how does that feel?
Really good to dance.
It wasn't as scary, I think,
Yeah.
as you thought it was,
I
right?
thought it was scary, but when I got through it, it wasn't.